Good afternoon, everyone. Today I will take class on advanced neuroimaging and neuroradiology, right? It's a completely radiologic topic. It will help you in practical life. I'll cover this topic under the following heading. This first, advanced MRI sequences, epilepsy imaging, leukodystrophy, metabolic disorder, congenital brain disorder, and radiological pathological correlation. So I'll deal. Later, I will discuss if there is any question. Okay. So first, we will go for the and this sequences. No, first sequence you have heard about this word diffusion weighted imaging (DWI). So what is diffusion weighted imaging? It's a measure of random motion of water molecules. Our body 70% is made of water. Everything a scan is principle based on the water molecule. Okay, so if I is saying that there is something hypo intense in diffusion, then restricted diffusion. Hyperfeatured imaging means restricted diffusion. So you have gone through the in pathology in second year that different type of different type of necrosis, like in that first say edema, right? That is cytotoxic edema. So when diffusion weighted imaging used in acute stroke, this is gold standard, and tumor abscess and infection. So in real world scenario, we'll take this this diffusion weighted imaging when tissues get damaged, right? Like a cytotoxidema, water get trapped inside the cell. Hence, water cannot move freely, and hence on the imaging when you do MRI on diffusion weighted imaging, you'll see a bright imaging, right? So whenever you come to know when bright diffusion weighted imaging plus one word is here dark ADC. Anybody know dark ADC? No, I'll discuss this dark ADC, right? What is a dark ADC, right? So if they diffusion weighted image plus dark ADC rear restriction, that means true there is some problem is there, right? This acute problem is there. Now I'll take this clinical example. Now 2-year-old presents sudden seizure. Okay, altered sensorium. Not somebody send you images like diffusion weighted image showing multiple bright spot. Then you come to know something is showing diffusion weighted imaging. That is acute ischemic stroke from vasculitis, right? Now the term ADC will come. Diffusion weighted imaging is starting phase. Now to support the diffusion weighted image, what is term ADC? So is it a diffusion weighted image true or false? This is supported by ADC, right? What is ADC? In nothing but apparent diffusion coefficient, right? So I'll discuss in detail that here. So come first, diffusion weighted imaging. Diffusion means what? Water molecule, right? I will go next slide. So diffusion weighted imaging we can use in other scenario, like when a child, newborn child, a child newborn, in week after 1 to 3 days we can order a diffusion weighted imaging on MRI. Then herpes encephalitis, brain abscess. So these are the true diffusion weighted imaging where required. If next time whenever you order a investigation on MRI, you can write in detail like I want diffusion weighted imaging. This is already now in technology already updated. You should not say, but you should know what is this. Now I already discussed what is ADC. ADC stands for apparent diffusion coefficient. No, diffusion weighted image is qualitative thing. Now here it is the ADC is quantity term, right? Which is already derived from the diffusion weighted imaging, which describe a diffusion weighted diffusion DWI in quantity wise basis, right? So it is a quantity parameter derived from diffusion weighted imaging on MRI and reflects the degree of water molecule diffusion within the tissue. It says how much water molecule diffusing in the tissue, right? So first one basic concept. So whenever you order free diffusion weighted image, next you should think about ADC. What about ADC, right? So if free diffusion of water is there.
Welcome to the world of advanced neuroimaging, where technology reveals the brain in extraordinary detail, from MRI and CT to advanced vascular imaging. We decode function, structure, and connectivity, detecting strokes early, saving critical time, accurately diagnosing tumors and neurological disorders, enhanced by AI for precision and confidence. empowering clinicians with clearer insights, improving outcomes through smarter imaging, advanced neuroimaging, and neuroradiology, imaging the future of neuroscience.